We want to turn now to the World Health Organization issuing a warning, saying that more than half of all Europeans could be infected with Omicron over the next couple of months. Our senior foreign correspondent, Ian Pannell, is in London for us this morning with more. Hello there, Ian.
Yeah, good morning, TJ. That's right. Europe apparently is facing a tidal wave of Omicron COVID infections. That's according to the World Health Organization. Like in America, the variant's sweeping across towns and cities almost unhindered. In the first week of this year, get this, 7 million cases were reported in Europe. That's more than doubling in a 2-week period. One estimate now from the Institute for Health Metrics and Evaluation forecasting that more than 50% of the population throughout this region is going to be infected with Omicron in the next 6 to 8 weeks. However, mortality rates for now are stable. And as we've seen elsewhere, it's those regions and countries with low vaccination rates that are seeing the biggest numbers of infections. And there's no doubting that Omicron is almost everywhere now. Every single country in Europe and Central Asia is reporting cases. The good news is that, as we're seeing here in the UK, the vaccines are providing generally good protection against severe disease and death. But because of the sheer scale of transmission, hospitalizations are on the rise. And as the variant moves to areas and countries with these low vaccination rates, there are real fears the impact could be even worse. George?
Ian Pannell, thanks. Let's bring back our friend Dr. Ashish Jha, the Dean of the Brown University School of Public Health. Dr. Jha, thanks for coming back. I know you've been extra busy right now. You're in the middle of a stretch of hospital duty as we face these record numbers of hospitalizations. Tell us what you're seeing.
Yeah, good morning, George. Thanks for having me back. What I'm seeing is a lot of patients with COVID, some of them incidental, but a lot of people getting admitted for COVID. Almost all of them are unvaccinated. A few of them are people who are vaccinated, high-risk individuals who didn't get a booster. My personal experience in the last couple of weeks, haven't seen a single boosted person admitted to the hospital for COVID. So that's pretty remarkable given how widespread this virus is.
Right, it shows how powerful the booster can be. We also have that study out of California, 70,000 cases, no one on a ventilator.
Yeah. No, this is another really piece of good news. Look, the problem is that for unvaccinated people or people who have not gotten boosted who are high risk, yes, and they may not end up on a ventilator, they're still getting quite sick from this. But it does show that Omicron seems to have less of an effect on lung disease, and that's hopeful.
We're heading towards a peak of cases, also a peak of confusion. Walk through again your best guidance for people if they do contract Omicron, what they should do, how long they should isolate, what should be the aftermath.
Absolutely. So the first 5 days after you've developed symptoms or test positive, those are your most contagious days. It's really critical you isolate during that time period. After that, what I have been recommending is you get a test. If you're negative, you get a rapid test. If you're negative, I think you're good to go. If you can't get a test, it's essential people wear masks around others because some people will still continue to be contagious, even though the first 5 days is the most critical.
And on those masks, we know the CDC is weighing whether it is your new mask guidance requiring these KN95s or recommending these KN95s. What do you make of that?
Yeah, look, the most important mask, the best mask is the one that you'll wear all day. So if you can figure out a good, well-fitting mask that fits your nose and mouth, that's the most critical. No doubt about it, KN95s, N95s, KF94s, there's a series of masks out there that are much higher quality. I wear them all day in the hospital. That's what I recommend if people can do that in indoor settings. Many of them are comfortable. Key, though, wear a mask that you can tolerate all day. That's the most important.
Dr. Jha, thanks as always for your time and your information. Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.